drugs acting on the central nervous system. As you know, nervous system classified into central nervous system and peripheral nervous system. Now I am going to discuss about central nervous system or drugs which acts on the central nervous system. To facilitate the understanding of the pharmacological and unwanted effects of CNS drugs, which is important to know about CNS neurotransmitters. Deficiency or excessive production of these CNS neurotransmitters are supposed to involve in CNS disorder, so it is important to discuss about these neurotransmitters. Noradrenaline is one of the neurotransmitters which is important in control of mood, wakefulness, and alertness, so its deficiency can cause depression. The other CNS neurotransmitter is dopamine, which is important in motor control, so deficiency of dopamine in the basal ganglia can cause Parkinsonism. Dopamine also involved in behavioral effects. Excessive dopaminergic activity can cause a psychotic problem like schizophrenia. Serotonin or 5-HT, 5-HT means 5-hydroxytryptamine, can be important to regulate different function. It controls also mood and emotion, so that it is supposed to involve it in psychotic, like antipsychotic drugs can act on this receptor. This is what we are going to discuss when we discuss about psychotic drugs. The other neurotransmitter is acetylcholine, which is important for short-term memory, so that deficiency of acetylcholine can cause dementia or disease of forgetfulness. It can also involve it in Parkinsonism. This is also what we are going to discuss when we discuss about Parkinson's disease. The other neurotransmitters are GABA and glycine, which are inhibitory neurotransmitters. They act on GABA receptor. GABA means gamma aminobutyric acid, which stimulates GABA receptor in the central nervous system, whereas glycine acts on the GABA-like receptor in the spinal cord. Both neurotransmitters are inhibitory. Let's discuss about the general anesthetic drugs. We have general anesthetic drugs and local anesthetic drugs. Local anesthetic drugs have a local effect. They don't cause unconsciousness, whereas general anesthetic drugs cause unconsciousness. So, the loss of consciousness is associated with inhibition of the activity of reticular formation. The reticular formation is found in the brain stem. When it is inhibited, it causes unconsciousness. So the mechanism of action of general anesthetic agent is by inhibiting this reticular formation. So we have inhalational general anesthetic agent and intravenous general anesthetic agents. That are what we are going to discuss. Inhalation anesthetics, halothane, nitrous oxide, and so forth. We will discuss an important point about these agents. Halothane, which is the most widely used agent. It has an adverse effects of hangover and the risk of liver damage. So these effects are enhanced when halothane is taken repeatedly. Halothane, relatively, which is a weak analgesic, so that halothane should be given with anesthetic agent that have a good analgesic effect, like nitrous oxide. Halothane has a pleasant odor, which is suitable for children, and some anesthetic agents have a problem on asthmatic patients, but halothane is safe for asthmatics, so this is an important point about halothane. Influrin is another general anesthetic agent. Since it is poorly metabolized in the liver, which is less toxic than halothane. As I have discussed, halothane, if it is taken repeatedly, it has a liver toxicity effect. Whereas since enflurane is poorly metabolized in the liver, the toxic or the liver toxicity is less as compared to halothane. The other anesthetic agents are intravenous anesthetic agents. Intravenous anesthetic agents have a fast onset of action. They induce unconsciousness within 20 seconds. So we have thiopental, Etomidate, Propofol, and so forth. Let's see important points about some of these IV anesthetic agents. Thiopental, which is an ultra-short-acting barbiturate drug, it causes cardiovascular depression as an adverse effect. The general anesthetic agent can depress most of the central nervous system except medulla. But when their dose increase, they also suppress medulla. As you know, medulla control the functions of vital organs like cardiac, heart, lung, and so forth. It can control cardiac functions, respiratory functions. So when medulla is depressed, so the cardiac functions and respiratory arrest can be a problem. So in this regard, thiopental can cause cardiovascular depression as an adverse effect. The other is etomidate. The cardiovascular depression effects of etomidate is less as compared to thiopental because etomidate is more quickly metabolized. But etomidate can be a cause of death for severely ill patients due to suppressions of adrenal cortex. This is one of an important point about etomidate. Propofol. Propofol is another drug. This drug is supposed to be the cause of death for the great world musician Michael Jackson. He was said to be abused this drug because this drug just cause euphoria, excessive happiness. So it is liable to be addicted. So Michael Jackson was died by taking an overdose of this propofol. So propofol is an important general anesthetic agent to be given intravenously for surgery of spinal tumors. Now, an important thing here is why we use propofol for surgery of spinal tumor is a spinal tumor can cause increased intracranial pressure, but propofol decrease intracranial pressure, so that we use, which is a good or a preferable drug to be used as an anesthetic agent for spinal tumor surgery. The other anesthetic agent is opioids, opioid analgesic for anesthesia. Opioid analgesics are a good anesthetic agent to be used for cardiac surgery, for patients who are undergoing cardiac surgery, because opioids are safe for homeostasis and just analgesic effect. So fentanyl and its derivatives are commonly used for this anesthetic purpose. Opioids also good to induce sedation, so that's which is preferable for cardiac surgery.